it's Khaki. Today I would like to talk to you about choosing which bariatric surgery is best for you. This is often a very contentious topic for some reason, and I'm not exactly sure why. I have seen on some of the messaging boards, Facebook groups, support groups, that people will post a question: what made you decide to get the surgery that you did? And the moderators end up having to shut off comments because people get very defensive about this. So let's talk about it. In the United States, you really have two main options for bariatric surgery: a gastric bypass, which is also known as an RNY, or a vertical sleeve gastrectomy. Some people call it the sleeve or VSG. There are other procedures that are not as commonly done, like a duodenal switch. Pretty much nobody does a lap band anymore. There is a gastric balloon procedure that's done, but those are the two that we're going to focus on today. So let's talk about just kind of what these surgeries are. In a gastric bypass, a pouch is made from a very small portion of the top of your stomach. Then the rest of the stomach is bypassed. The small intestine is pulled up and is attached to that small pouch. In a sleeve gastrectomy, the surgeon will go in and actually take about 80 to 85% of the stomach out and form the remaining stomach. Is made like the side of the stomach, if you think about it, is made into a sleeve, which kind of looks like a banana. And with that surgery, there is no rerouting of any of the intestines. It's just basically removing part of the stomach. The hospital stay, to compare the two, I know my surgeon and most of the surgeons in this area, if you have a gastric bypass, you stay a minimum of 1 night. These, now, what I'm talking about are people who do well, who don't have any complications. With the VSG or the sleeve, a lot of people have that as an outpatient, and you do not have to have a hospital stay. Time under anesthesia and how long are the procedures in comparison? A gastric sleeve, most surgeons do it in about 1 to 2 hours. A gastric bypass is a little bit more of a complex procedure, so most surgeons say 2 to 3 hours on that. That can make a difference in selecting procedures. If you are somebody who has some serious comorbidities like a serious heart disease, anything, breathing condition that you need to limit your time under anesthesia for medical reasons, that can actually be a pretty big consideration because one does require less time under anesthesia. Looking at weight loss, that's always a big decider in which surgery you want to have. Bypass, gastric bypass, the expected or typical weight loss is 70 to 80% of your excess weight that can be expected to be lost. So, for example, if you weigh 200 pounds and your ideal weight is 125, you're 75 pounds overweight, so you have 75 pounds of excess body weight. You can expect to lose 70 to 80% of that with a gastric bypass. With a gastric sleeve, statistically, it's 60 to 70% of that excess weight that you can expect to lose. Looking at what comorbid conditions you have, what other health concerns do you have? That can kind of play into which surgery you think might be right for you. With diabetes, there are statistically slightly better outcomes with gastric bypass when you look at the numbers. Uh, the big thing about diabetes, type 2 diabetes, it is very much a disease that's related in most people to weight and to diet. So, whichever procedure you choose to have, getting that weight off and changing your diet is probably going to improve your diabetes. So, that, looking at the gastric bypass, you do have some hormonal changes with it, which does lead to a little bit better outcome with diabetes. So, if that's a big factor, that might play into your decision. Hypertension, high blood pressure, that is directly related to weight loss. Outcomes tend to be better the more weight you lose. So if you're able to lose weight successfully, it's that's probably going to improve with either procedure. One big thing that can be a deciding factor in which surgery you choose is if you have acid reflux, GERD, gastroesophageal reflux disease, or severe indigestion. A sleeve can tend to make that worse because of the way that the pouch is formed. It becomes more of a high pressure area. The pressure in your stomach goes up, which means acid can go up more and hit that esophageal sphincter. There are some patients that I have seen that even if they don't have acid reflux, after a sleeve can develop it. And I have even had a couple of patients that do have to go on and have a conversion to a gastric bypass because of reflux. If you have reflux, if you have severe indigestion, definitely make your surgeon aware of that when you're going through the process of deciding on which surgery is right for you, because that may be a big determining factor. Another thing to think about is mental health. If you take medications for mental health concerns, make sure you make your surgeon aware of that, because there are ways that absorption is altered with the gastric bypass. There are certain medications that it may actually make a difference in how they're absorbed. The only way to know for sure is to make sure your surgeon knows, and that may guide their recommendations for you. So, what is life after surgery like with either of these procedures? Hopefully, much, much better. Hopefully, you will be off medication, have a remission of joint pain, have good weight loss with either one. The diet with both procedures after you have them is pretty much the same. Everybody is different. Everybody tolerates food differently. You may have a sleeve patient who has a problem with eggs for the rest of their life. You may have a gastric bypass patient who has a problem with eggs. Everybody is going to respond differently, but the recommended diet is the same after both procedures, after you go through the transition of periods. The vitamin intake, you need to take supplements for the rest of your life with either procedure, but because of the malabsorption that the gastric bypass causes, you do run a little bit greater risk of having vitamin deficiencies or anemia. So you need to be on top of your vitamin intake with either one, but with the bypass it is a little bit more important. I hate to say that, but it's true, to make sure that you take the vitamins that are recommended, the bariatric vitamins. With the gastric bypass, there is the possibility of some dumping, either early or late onset dumping. Early onset dumping typically manifest in GI symptoms, where late onset dumping manifest in low blood sugar. I've done videos about these. If you're interested, go back and look for those. It is much more likely to happen with gastric bypass. But the good news is most people, if they avoid the things that we probably should not be eating on a regular basis, avoid that. And it actually, I know for me, it actually serves as kind of a reminder, a negative feedback loop, that if I eat simple carbohydrates, I'm not going to feel good. So I actually kind of like that side effect to gastric bypass, but that's something to definitely think about when you make the decision which surgery you want to have. Cost. How does the cost compare? Well, hopefully your insurance is going to pay for it, but if it doesn't, gastric sleeve is a little bit less expensive. I refer patients sometimes. I'm in southern Middle Tennessee. We have a surgeon, a surgical center in Huntsville, Alabama, that has great cash pay prices and a very good reputation. I often have patients go there. Their cash pay for the gastric sleeve is $10,000. Their cash pay for a gastric bypass is $12,000. That does include a night in the hospital with the gastric bypass. So, that's not that big of a difference. So, hopefully, cost won't be a big deciding factor for you. One thing that I would definitely advise anybody who was in the process of deciding which surgery to have and visiting with surgeons is ask your surgeon, do you do both procedures? Do you do bypasses and do you do sleeves? If a surgeon tells you, oh no, I just do sleeve gastrectomies, I would be a little bit concerned about that because it's kind of like a gastroenterologist told me one time. We make our money off of colonoscopies. If you send somebody to me, they're going to get a colonoscopy. If all that a surgeon does is a gastric sleeve, they're going to tell you that's the best fit for you, whether it truly is or not. So keep that in mind. Also, the gastric bypass is a little bit more of a skilled procedure. They're both skilled, but it is a little bit more complex. So if a surgeon doesn't do it, I would want to know why they're not doing that procedure that's a little bit more complex. So how do you decide? I would do your research, read other people's experiences. There are weight loss calculators that you can go to that you put in your starting weight, which procedure you're thinking about, and will tell you what your realistic expectations are after each procedure. I would, when you go to your surgical consult, be sure to talk about any of your health issues that you've had in the past, what medications you take. Uh, Ask questions. And, this should be a joint decision. There should not be your surgeon telling you you have to have this unless there's a true medical condition that prohibits one procedure or another, like severe acid reflux. So, arming yourself with knowledge, becoming an informed patient, and honestly, whichever procedure you choose, it's hopefully the best one for you, and you will have great results with it. I would love to hear feedback on folks who are considering having surgery or who have had surgery. What led you to choose the procedure that you did? I would love to hear any other video ideas or suggestions that you have. I want to bring content that everybody can enjoy. I hope everybody has a great week, and I will see you next Wednesday. Bye.